Sheila here from Cigna. One of the things is she is one of the best presenters we are going to have on today, and we actually have the head of training from Allstate. So she's going to do circles around us. Get ready to be wowed. I'm so grateful you're here. Thank you so much, Sheila.
Thanks, Dan. Thank you guys so much for the opportunity to be here. As Dan said, I work for Cigna. I'm in the individual and family plan space. I'm actually the Mountain West broker manager, so I'm lead broker distribution for Arizona, Colorado, and Utah. In addition to that, I manage some of our national partner relationships, as well as our ICRA vendor solutions and things like that. So super excited to bring this content to you guys today. I'm just going to go through some high-level agenda items. So we're going to go through our values as an organization. I'm going to highlight the member value and some of the tools and resources that are available to the clients once they become a member with Cigna. I'll talk about the IFP footprint for 2024. I will review high level the product portfolio. As you guys know, in 14 states, we're going to have a lot of different plan designs. So I'll make sure you guys have those resources after the fact to be able to pull down those plan grids if you need some specific information. And then I'll highlight some of the key plans and then market insights to kind of so you're unaware of target markets that are performing really well, where we're going to be positioned really strongly in terms of price and network, and then all of the resources that are available to you guys to help service and enroll the clients. So with that, let's get into it. I don't know if you guys are aware, but Cigna actually went through a rebrand earlier this year. It's the second time I've been through a rebrand at Cigna, which says a lot. I've been with the company over 12 years. But really just wanted to highlight, our identity, our mission, and our vision. We are trailblazers. We are relentlessly partnering and innovating solutions for better health for our customers. Our mission is to improve the health and vitality of those that we serve. And our vision is a better future built on the vitality of every individual and every community. And so one of the things I just want to call out here is that you see the word vitality in a lot of those phrases that are on the screen. And that's something that we're really focused on for our members. We are on a mission to drive to 25. This initiative has been in place for a number of years now, but it's really intended to improve the health of the lives we touch, be the leader in value for our products and solutions, be the employer of choice, and to deliver on our financial promises to the organization. How does that translate to value for your clients? So we hope that we are helping give you tools to help individuals make smarter choices that provide personalized insights into their plan coverage and also ensure that we are receiving affordable coverage at the same time. Again, how do we bring value to you, how you effectively serve your clients? You do have access to your Cigna for Brokers account. I will talk a little bit about some of the improvements that we're making in those technology solutions. And then in addition to myself and my team, you also have dedicated broker support. Their contact information will be at the back of the presentation as well. And they're available 8 to 8 Central Time, Monday through Friday, to help with things that you might need assistance with relative to questions about plan designs, figuring out how to get somebody effectuated, how to service claim issues, etc. So a lot of really good tools for you guys. So we'll shift now to the Cigna member value. We're going to talk about My Cigna and the My Cigna app. I'll talk about virtual care, our pharmacy resources, our rewards and discount programs, which is really cool. And then my favorite thing is the One Guide program, which you may or may not be aware of, but this is a cool tool, and I'll explain it in more detail. So let's start with mycigna.com. So obviously this is the member portal where they can log in to find care and costs, view claims, pay their premiums online, and access their digital ID card. I love the digital ID card. I'm a personal user of that. I know that a physical ID card means a lot to a member, but this is a quick and easy way for them to be able to log on and maybe print that ID card if they don't have access to the physical card. Obviously, the My Cigna portal is attached to the member profile. So all of the resources relative to the provider lookup and the formulary and all of that is going to be organic to them when they log in. So it's designed specifically for their plan to be able to find the tools and resources that they need at their fingertips. And then the app version is really just an on-the-go version of mycigna.com. Again, they could look up a provider, they can pull down their ID card, you can view claims and coverages. So it's really kind of a catch-all. when we talk about the rewards program in a little bit, I'll just reference that they can take the health risk assessment through the rewards program on the mobile app. So it's on the go. They don't have to be logged into a desktop in order to do that. So it makes them much more adept to creating that profile and then getting that reward as easy as they can. So we do offer virtual care. I know everybody talks about virtual care. Our preferred vendor is MD Live. We actually own that organization. So that gives them 24/7 access to virtual care. It includes coverage for urgent care visits, routine visits, primary care, as well as dermatology and behavioral health. One of the things I'll call out on this slide is that when we think about time of place and the cost of care, anything that happens virtually is going to line up to whatever that benefit tier is at the plan level. So if I would spend a $25 copay to see my PCP, if I do a virtual visit with my primary care, it's going to match the same cost structure. So it'd also be $25. So it's something for you guys to note on that. Talking about pharmacy resources, I'm going to go over a lot of different things here. So the first thing is our home delivery service is Express Scripts by Evernorth. So again, it's an internal organization within Cigna. So that's a great resource for people that are on maintenance medications, so that they can get a 90-day fill delivered to their home. They don't have to worry about coordinating with a local pharmacy or going to pick it up. They can manage all that home delivery. The other cool thing about our relationship with Express Scripts is if somebody is utilizing our home delivery service, we do have physicians and nurses who are on staff to help coordinate the efficacy of their medications. So if they're taking a couple of different drugs, our team will analyze that and make sure there's not crossover, and maybe there's some things that are happening that they shouldn't be taking the same medication, or maybe they flag the fill too early, and then we can look at that and see why they're flagging the fill too early. So a lot of tools available to the members when they're utilizing that home delivery service. Our pharmacy network is the Walgreens Advantage Network, which I'll talk about in the next slide. And then obviously the affordability tools also connected to Express Scripts and our formulary. And then there is a link, I think, at the end of this that you could search the formulary. So there is, obviously I know you could look up a lot of stuff through HealthStrip or healthcare.gov. I'm a big proponent that if you really need to know for sure, go directly to the carrier and confirm that it's on the formulary, because the formulary can change on a dime. So our provider lookup for formulary is actually really nice, because you can literally just type in a couple of letters and the list will pop up of any of those drugs. You click on that and then it will show you how it's covered in the tiering structure for pharmacy benefits. And then if it requires a prior auth or some other kind of exception that you might need to assist your customer with. All right, so moving on to the Walgreens Advantage program. So we have over 43,000 pharmacies. They will do also 30 and 90-day fills at the pharmacy if they want to do that versus the mail order. The only markets that the Walgreens Advantage program is not in is Texas and Virginia. That is the CVS network, which we call Cigna 90. So if you need information on that, it's on the website as well. And essentially, the Walgreens Advantage network is all the big box. So you think about Walgreens, Costco, Walmart, some of the Safeway and Albertsons drugstores. So CVS, it's a very large network. So we're not just targeting specifically Walgreens. It is definitely a lot of the national brands. And I love the fact that you can go to Costco and get your prescription filled there as well. I want to also talk about the patient assurance program. So in some of our markets, and we'll talk about this a little bit on another slide, we do have the enhanced diabetes care plan, but for those that may not have that accessible to them in that particular market, we do have the patient assurance program. And so what that does is it allows customers that have diabetes to save on their insulin and non-insulin medications if they do not have the enhanced diabetes care plan available to them in that market. So it's a really nice program to help them save at the cost of time of getting that prescription filled. And then, of course, we have our tiering structure, tier 1, 2, 3, 4, 5. Tier 1 are those ACA generics. that need to be covered. And then we've got the generic tier at number 2, preferred brand at 3, non-preferred brand at 4, and then specialty pharmacy at tier number 5. All right, moving on to the rewards and discount program. So the Take Control Rewards program we've had in place for a number of years. We're going to continue that customer loyalty program. As they engage in healthy behaviors, they do earn points, and the points can be redeemed for experiences, merchandise, gift cards, etc. So that's all driven through mycigna.com. If they complete the health assessment, again, it's available on the mobile app. It takes about 3 minutes. They earn $75. If they go and see their PCP for a well visit, that's another $100. So those two things right out the gate seem pretty easy to fulfill, and that would give them $175. They do then have the ability to earn up to $325 throughout the calendar year. And again, that portal is designed for them to be able to take those points, convert them into actual dollars, and purchase things that are relevant to them. It could be work-life balance. It could be that they want to exchange for a gift card to help them pay for other things. So there's a lot of flexibility in the program. We're really excited to have this available again this year. It is applicable to policyholders who are over the age of 18. So just caveat that. And then moving on to the Healthy Rewards program, Cigna's had Healthy Rewards for probably 15 years or more. This is really just a deep discount program that's available. So for things that are not covered on the traditional health plan, like fitness club memberships, maybe they don't have a very robust chiropractic, or maybe they're looking for acupuncture, they can go find specialty providers through the Healthy Rewards program and get discounts on those services. There's also discounts on wearable fitness devices. If they don't have hearing or vision coverage, they could use the Healthy Rewards discount to locate a provider and get a discount on their exam, their hearing aids, or maybe their vision exam or their materials that they might need. So 2 really, really incredible programs that are available to all of our members. My favorite. So One Guide, if you will, is almost like a personal guide and a bypass for member services. So this program really is combining digital technology and personalized services to help the customers. So if they need assistance finding quality care, if they maybe got an out-of-network bill and they're not sure if they need to pay that or not, they can contact the One Guide team. If they need assistance with managing a new diagnosis, they can call the One Guide team. If they need help just navigating their plan, this is a resource for them that gives them a personalized service and a personalized guide. All right, so let's move on to the footprint. And I see your questions. I'll try and grab those at the end if that's okay. So going into 2024, our footprint is shrinking a little bit. We are exiting a couple of states, and we are expanding into the Charlotte area in North Carolina. So we will be in 14 states for individual and family for 2024, Arizona, Colorado, and Utah, Texas, Illinois, Indiana, Tennessee, Mississippi, Florida, Georgia, North and South Carolina, Virginia, and Pennsylvania. So we're really excited about the footprint. It's going to help us with our Drive to 25 goals and really help us focus on the states that we have been successful in thus far. I do want to also call out our IFP dental footprint. So I know this slide is a little bit busy, but it is color coded. So anything that's in the light blue have our entire suite of dental products available, which last year we actually expanded this product portfolio from 3 products to 9. So we have high maximum plans and we have some combined plans, which include vision and or vision and hearing. So any of the blue states have our entire product suite available. Those in orange only have the preventive plans and the combo plans, so none of the high maximum plans. And then those in green only have the traditional plans only. And then New Mexico is kind of on its own, what it's got available as well. So a lot of opportunity here. I'm happy to share any additional resources that you guys have or need about IFP dental. One thing I'll call out is that this product was built with all age in mind. So it goes down to child, it goes beyond age 65. So it's really a catch-all for anybody that might need coverage on the individual and family plan chassis, regardless of what their circumstance might be. All right, moving on to the 2024 plans. So I'm just going to give you some high-level highlights on the plans. So on average, we're going to have 12 plans available per market. This is in response to the CMS guidelines that are limiting our non-standard plans. So we've had to shrink our portfolio. But I am happy to say our product team was very thoughtful about how they evaluated these changes, what we thought were well-performing plans in terms of high enrollment, and then also eliminating some of the plans that maybe weren't functioning as well, and then mapping those plans also in a very thoughtful way. I call that out because when we send renewal letters to members, we will make recommendations on plans that would be suitable to them based on their current enrollment structure. So that's something that I would definitely note. We will have the standardized plans in every metal tier except for Colorado and Pennsylvania. Those are state-based marketplaces, so those have their own set of challenges. We also will be in Virginia as well for 2024. We will have a $0 bronze deductible plan in $0 bronze plan in most of the markets that we're in. So that's a fully subsidized customer that will have a $0 premium. So we're excited about that opportunity. Many of our plans have first dollar coverage relative to specialist, PCP, and urgent care on the bronze plans. I think a couple of things that you'll see is really a shift towards lower out-of-pocket cost at the time of care. Specifically on urgent care, most of the structure is going to cost $50 or less for them to go to urgent care. So we really want to promote the utilization of that benefit. And then, like I said, a lot of $0 primary care visits. We really want our members to be going to the doctor and getting those well checks so that they do not become a catastrophic. And then we do have the enhanced diabetes plan in some of our markets. So keep a lookout for that. What's interesting about the diabetes plans is that they don't necessarily have to be a diabetic in the plan, but if they enroll, they're going to get some better at cost share at time of service. So a lot of really cool benefits on that. In terms of pharmacy, we do have either $0 or $3 co-payments in all of our tier 1 across the markets. So really trying to encourage people to take those maintenance meds and get a lower out-of-pocket cost on those. There is a lab copay available in almost all of our markets. And then also emergency room copay is available in most of the markets except for Tennessee. So again, we're trying to really create static copay out-of-pocket cost for members to really understand what they're paying and what their obligation is on their plan versus trying to create really complicated structures with the high deductible plans that have a co-insurance structure. So a lot of thoughtful work done around that. So let's talk a little bit about the enhanced diabetes care plan specifically. So it's a $0 copay for preferred insulin, metformin, and other medications that they might take. The deductible is waived for diabetes supplies and equipment and education, for services like A1C testing, neuropathy, retinal eye exams that they might need, and then also nutritional counseling and routine foot care. So we're really trying to enhance this product for those that might have diabetes. There is a specific drug list for the diabetic supplies, so make sure you look at that. If they have a particular monitor that they might be using, you definitely want to double check that and see where those supplies are going to sit on the tiering structure. And then we do have $0 for select labs and copays and exams on that plan. And then there's no greater than a $25 out-of-pocket cost for the insulin, again, through our patient assurance program. This is kind of a busy slide, but it really was designed to show you guys at a high level across all 14 of our markets, what are the product offerings that we find are really valuable and in which markets are those available. So if we go across the top, we've got a $0 PCP. You can see it's almost in every market that we're in. There are a couple of states that there is a $0 deductible, which is both medical and RX, because we do have some plans that have maybe a $0 deductible for medical, but have a pharmacy deductible. So keep in mind that component. You can see that in every market except for Mississippi and Texas, we do have that $0 deductible bronze, which is a very, very popular plan. We do have $0 medical only deductible in silver in a couple of our markets. We do have a handful of markets that have an HSA plan. We do have some markets that have off exchange only plans. We do have many of our plans that have a $3 drug copay, quite a few that have a $0 drug copay. And then we do have drug copays in tier 3 on all of our markets, across all of our markets. Now I'm going to call out a few plans that are of note and the market in which they sit. So in Florida, we want to call out the Connect Bronze Zero individual medical deductible. So again, this has a $0 medical deductible, but does have a pharmacy deductible. And you'll see, kind of referencing back what I mentioned before, copay structure is pretty heavy on this plan. So they've got a $50 PCP copay, $115 for the specialist. If they need to go to the emergency room, it's $1,400. $50 for the urgent care, and then you can see the pharmacy tiering beyond that. So we're really excited about this plan, and this is available in other markets as well, but just calling it out specifically for Florida. In North Carolina, we've got a $6,500 deductible bronze plan. You'll see there's a lot of coinsurance after deductible built into this plan. So this might be good for somebody who is either a low or a high utilizer, depending on what their circumstance might be. If they need, if they're on a maintenance med in a generic tier, this might be a decent plan for them to enroll in. And then we also have the silver $4,500 deductible, also North Carolina. So we've got both a deductible $4,500. A lot of those tiering structures you can see are waived. So primary care, for example, we waive the deductible. They only have a copay. Specialist deductibles waived, only have a copay. Urgent care, the same. Emergency room, the same. So it's really just those lab x-ray type services that are going to be applicable to the deductible. So great plan design there as well. Moving on to some of the CSR plans. So these are not the base, these are actually the cost share reduction plans. So in Florida, we've got what we're calling the Silver -4A and the 4B. So these will have a much lower out-of-pocket cost at the time of care. So you'll see $0 deductibles, $0 primary care, very low specialist copays, low copays in tier 1, 2. And so we're really excited about those plans as well. And then in Texas, we've got the 87 and the 94 CSRs, which we're calling the -3B and the -4A. Again, similar structure around the copays, just really reducing those at the out-of-pocket cost at the time of care. Okay, so I'm going to show you guys some of our hot markets in terms of pricing, and then I'll talk a little bit about some of the geographic areas where we're expecting to be very strong. So pricing wise, we are going to be positioned very well in Colorado, in Denver, Boulder, Fort Collins, and Greeley. That's why they're #1 on the list. #2 is the Dallas-Fort Worth area in Texas. #3 is Charlotte in North Carolina. Again, an expansion market for us, which we're really excited about. And I'll talk a little bit about the care provider in that area on the next slide, which supports the expansion into that territory. #4, we've got the Gulf Coast and DeSoto areas. #5 in Florida, we've got the Treasure Coast and Palm Beach areas. #6 in Tennessee, we've got Jackson and the Tri-City area. Indianapolis in Indiana, and then we've got Northern Virginia in Virginia that we feel we're going to be really competitive as well. So wanted to just highlight some of our provider network providers in these hot areas as well. So in Florida, we're contracted with Memorial, Orlando, the Cleveland Clinic, and Baptist Health. In Tennessee, we are contracted with Methodist, Vanderbilt, West Tennessee, and University of Tennessee Medical Center. North Carolina, we're contracted with Duke, WakeMed, Mission, and EUC, and Novant is a new provider relationship for us, which is really great and why we believe we're going to be so strong in the North Carolina area for 2024. In Mississippi, our partners are Methodist, Merit, Oshner, North Mississippi, and Memorial. And then in Virginia, we're with VCU, Innova, and VHC Health. So I promised you in the beginning, I'd give you kind of a graded scale of where we think we're going to be really competitive from a price perspective as well as network. So ranked number 1 is Colorado. We've got an A+ rating and an A network rating, and then we'll kind of go down from there. In Tennessee, we are at a B+ rating, but an A network rating. So we still believe we're going to be pretty strong in Tennessee. Still to be determined in Arizona, but our network is sitting at an A-. Florida, we're sitting a little bit disadvantaged in price and a little bit disadvantaged in network, but we hope we'll pick up some speed there. Texas, we're priced aggressively with a B network rating. And then I would also, a couple of call outs here, I'm sure you can tell by the slide, but we're not going to be really strong in the Virginia, South Carolina, Pennsylvania, and Georgia markets. I would maybe definitely evaluate Georgia if you haven't already, because that market has been a little bit of a challenge for us in 23, which is why we've got the rating like we do for 2024. Okay, so focusing a little bit on the Mid-Atlantic area, we're going to talk a little bit about Virginia, North Carolina, and South Carolina. We have great brand awareness in all of our markets, but we particularly feel strongly about that in Virginia. We have a strong provider network and competitive broker commission and bonus. I don't have the details about commission and bonus during this presentation today, but that is going to be released very, very soon. So keep you posted on that. North Carolina, again, market expansion. I feel like I'm beating a dead horse on that, but we will be in 15 counties in North Carolina. It's our largest geographic footprint in all of our markets. We already talked about Navant, and then again, commission and broker bonus to be determined. And finally, South Carolina, we have a partnership with Conway Medical Center and Tidelands, and of course, highlighting the Take Control Rewards program in that area. Shifting to the Midwest, Illinois, Indiana, and Pennsylvania. So Illinois is going to have competitive pricing in both DuPage and Kankakee counties. Northwestern co-branded product is available in 4 of Chicago area counties, so be on the lookout for that as well. And then we know we've got some unique product offerings available in the bronze metal for the Connect plans in 2024. For Indiana, we're focused on retention for 2024 after a successful open enrollment for 2023. We're going to continue to grow our brand awareness and focus on our unique product offerings. In Pennsylvania, we do have a standout network, and the enhanced diabetes plan is available in that market. So the Southwest area, Tennessee, Georgia, and Mississippi. In Tennessee, we're going to be low cost in both Jackson and the Tri-City area, which I mentioned, I think, in a slide or two before. Good brand awareness, and we do have access to the Vanderbilt network statewide, which is great. In Georgia, we have a superior network in Atlanta with Wellstar, Piedmont, Grady, and CHOA, and we should have competitive pricing in the Savannah market for an area of focus. In Mississippi, there is some network expansion, not county expansion, network expansion in the Gulf Coast and Hattiesburg, which is going to give us a lift there. We will have competitive market pricing, and we do have the Methodist Hospital in North Mississippi. Mountain West, my region. In Arizona, we have great brand awareness. We are in Maricopa and Yavapai counties. We are actually exiting Gila and Pinal counties in this market for 2024. We have a partnership with Evernorth Care Group, which is an all-in-one PCP practice. So that's a great opportunity for us as well. In Colorado, we have a very broad network footprint. We will be the low-cost leader, and there are a lot of strong opportunities in some of the northern counties in Colorado. In Utah, we've been in this market for a number of years. It is very stable for us. We are selling in Salt Lake and Utah counties, and our pricing has been pretty consistent year over year. And I'm going to call out 2 states specifically that were not on the previous slide. So the first is Texas. We are trusted and stable in this turbulent market, as I'm sure you guys have felt over the last couple of years with the carrier exits. We will have competitive pricing in Dallas-Fort Worth, so keep an eye out for that. And we will have great product design in that marketplace as well. In Florida, we have a strong network in all counties. We are filed that we do not require referrals. Obviously, referrals are recommended, but not required. Talk about the provider network again, you'll see that we are one of the only carriers with the combination of Baptist, Memorial, Mount Sinai, Cleveland Clinic, Jackson, and Tenet. So something to look out for is the Treasure Coast Low Cost Silver. I would be remiss if I didn't talk about some of the 2024 curveballs that we have been facing, so creating some headwinds for us. The Friday Health exit, which is continuing to impact us in our Colorado, North Carolina, and Georgia markets. The CMS regulatory environment, which is cutting down our plan options to 4 per metal tier that are non-standard. And in addition, as I'm sure you are all aware, the client consent form. And then finally, risk adjustment pressure. There is a big focus for ACA carriers to be profitable. And so that puts a lot of pressure on us as an organization and how we manage these members. Okay, before I go to broker resources, I'm going to just check this Q&A real quick. All right, can you enroll in a disease-specific plan if you don't have that disease diabetes plan? And if not, can family members without the disease be on the same disease-specific plan? That is a wonderful question. The answer is yes, they can enroll. They do not have to have the disease in order to enroll in the plan. Obviously, those plans were designed with that in mind, but we know that circumstances, might drive others to those types of plan designs because they look more desirable. So that's a great call out. And that was the second question, same question. Good, cool. All right, moving on to broker resources. Okay, so I'm sure you're all aware, Cignaforbrokers.com can have its own set of challenges. I am painfully aware of that. But at any rate, we are really making a lot of effort to improve that experience for you. So we are excited that we're going to be able to allow you to make payments on behalf of your customers through the broker portal. I don't know specifically if this will be ready during open enrollment, but I know it will be available in at least by first quarter of next year. So we are all very excited about that, to be able to have you guys actually self-service your clients and help them get effectuated sooner rather than later. And we are also adding new data fields to our book of business and our commission reports. So we know that right now we don't give you guys a whole lot of information relative to those reporting tools. And so there's a lot of work being done to really give you guys a lift on that, to be able to have more information at your fingertips that is not existent today. Snapshot of the Cigna for Brokers portal. Call out number one is number one on the resource center on the right-hand side. So that's where you'll find most of the tools available for you to help consult during the open enrollment period. So plan grids, certificates of coverage, summary of benefits, other flyers that you can use to help, with the why Cigna, talk about Take Control Rewards program, the enhanced diabetes plan. So this will be the catch-all for most of the information that you need. We will also have an ungated site. So if you need a quick hit of information, you can go to the ungated site and pull down some resources there as well. I'll make sure that you guys have all of those links and information available to you. So those are two really cool things. Our quote and enroll tool, there's both the medical and the dental links on Cigna for Brokers. We'll talk a little bit about those on the next slide. And then finally, what I mentioned before on the book of business, to be able to filter, view various reports like a renewal summary, pending payment reports, so that you guys can really start to help manage what's going on with your customers on the front end as they're trying to get enrolled in their coverage. So our dental tool is Express app. So this is where you can go on and quote the IFP dental plans. What's really neat, earlier this year, we actually released a grid tool on the bottom. So even though the tool itself doesn't necessarily do a great job of comparing the plans together, the grid tool will allow you to do that. So you could stack up a preventive plan on top of a combo plan and see where the pricing might differ for your client or their family. So that's where you would go for IFP dental. And then IFP medical, our quote and enroll tool is a white labeled health Sherpa. So you can quote both on and off exchange by going through the Cigna for Broker portal. If you don't need to use that, you don't have to log in there, but it is available to you if you wanted to use that tool. And then information about billing and enrollment payment information. So we have a lot of different ways that your members can set up their payments. So you'll see links that come through directly to members, and then you guys should get copied on those correspondence as well. We send an email electronically, and in some circumstances, we'll send them a paper letter in the mail about how to make their payment. One call out here is that they can use their credit card for binder payment only. For any auto pay setup, they do have to set up an EFT with their banking information. So again, credit card is for binder payment only. And then they can pay their bill and set up auto pay through mycigna.com as well. Another really great tool is the 800 number. It's an automated phone system, so they can literally just call and plug in their payment information and they're ready to go. We do have a mail option, which I wouldn't recommend if possible to avoid because it can get a little bit problematic. And then just some reminders about timing of the binder payments. So on exchange, they have until the effective date or up to 30 calendar days after the application date to make their binder payment. If they are renewing app, they will have to make their payment by December 31st for January 24 and January 31st for a February 24 effective date. EFT drafts occur on the 5th of the month on exchange. So that's something to call out if your customers are wondering when that draft's going to occur. It's on the 5th. And then off exchange, initial payment is required with the submission of the application, and that EFT draft occurs on the day before the due date of their premium. All right, I'm going to pause there for questions. I've got one in the chat. Let me see what that says. Is there a diabetes plan in Indiana? That's a great question. I will have to get back to you about that. Any other questions? I know I went through that really fast.
You killed it though. Saying. We tried to build this in a high level capacity for you guys, knowing that every market's got its own set of plans and what's going on in each space, rating structure, etc. So hopefully the things that we called out were helpful to you guys. Like I said, every market's going to have its own plan grids, so you'll have access to all that information. We do have flyers that also have a map with the county footprint and the hospital systems that are in those areas. So that's a good point of reference if you've got a customer that you're talking to and they have a specific facility or provider like system that they're wanting to access. So I'll make sure you have the links to all of that as well, Dan. And then all of the other details, there's flyers specifically about the diabetes program. There's flyers specifically about take control. So it's just a lot of information to put into one little place for you guys. That diabetes program though, that's going to be big.
Yeah, it's a really thoughtfully designed plan. And I mean, like I said, not everybody that has the condition is going to go into it, but it's designed in a way that it's also pretty it looks very appealing, right? Because it's low out-of-pocket expense at time of care. So if you got somebody that even has a different type of maybe chronic condition that isn't diabetes, that might actually serve them really well. If I had a cardiac issue, I might like that plan because I might see my cardiologist a few times a year. And if I only have to pay, $15 or whatever, that might be really beneficial.
Ooh, you had a few questions pop in here.
Yeah. So there are some teledoc options that are $0 copay. Just want to make sure you're looking at the plan. I know I talked about virtual care before, that our preferred vendor is MD Live. There, obviously, a lot of the providers have adopted kind of a telehealth philosophy now as we're coming out of the pandemic, when that was kind of out of necessity to service customers. So again, just keep in mind that those copay structures match the plan. So PCP in office, PCP virtually are going to be the same cost share. So just look into that for sure. CSR Connect plans, are there particular differences? Okay, so we do not, it's a wonderful question. Thank you for actually asking that question. So Cigna does not take the position that we have different networks based on our plan designs. Future state, that might be the case, but for now, the Connect network crosses all of our product. So whether it's standardized or non-standardized plan, they access the same network of physicians and facilities. So we're not deviating from that. Some carriers I know are doing that. They're building a separate network. We are not doing that today. Again, future state potentially, but for right now, the network is the network, regardless of whether it is a CMS standardized or state-based standardized plan, or a non-standard plan that we've designed on our own.
That's
Great
awesome.
question. Yeah, it's a good question.
He came from ACE. I'm actually not shocked by that. He's usually brings his A game too. So I'm like,
I love it. Okay, so IFP is individual and family plans. It's just the chassis. Yep. Perfect. What other questions can I answer for you? I'll get back to you on the Indiana question.
okay, for Mr. Long.
Yeah, I'll have to look at the plan grid if it's available there. And like, honestly, guys, this was the crux of the difficulty in the product team, trying to figure out how we pivot from having somewhere in upwards of 8 or more plans in every metal tier down to 4, right? So that's a hard thing to figure out. And in some markets, those condition-specific plans went away because they were newer, they didn't have as much enrollment. We had to figure out how to pull some triggers to fit into the suite. So that's why I always want to just call out, it is very market specific, just based on what products were already available there and what we had to cut.
Gotcha.
Awesome. Well, thank you guys for your time. I hope that was helpful. I know it was a lot. If you have any questions, please just lean on our team. We are here to support you. We know you've got a lot of other people you've got to know about their plans and products. So any questions that you have, please lean on us. That's what we're here for.
Thank you, Sheila. Guys, just to be fully transparent, Sheila's like the most amazing person to work with, right? She's really helped us grow like our Cigna relationship a lot. So thank you, Sheila. And, you know, it's been great.
You're welcome. Have a great day, you guys. Happy selling.
All right. Thank you, Sheila.